Hi, my name is Heather Caton, and this is my PowerPoint regarding nutrition and critical care. The objectives are that by the end of this presentation, the nurse will be able to determine when it is appropriate to hold enteral nutrition based on gastric residual values. The nurse will also be able to identify potential problems that can occur if nutrition is not started in a timely manner. By the end of this presentation, the nurse will be able to determine if a patient is able to start enteral nutrition. Here are the questions that you were asked prior to this presentation, and you should be able to answer these questions once the presentation is finished. What is the recommended time frame that nutrition should be initiated on a patient? Which patients should be screened for nutrition? What approximate percentage of patients are malnourished at the time of admission to the hospital? What approximate percentage of patients become malnourished after admission to the hospital? What potential problems can occur if nutrition is not started in a timely manner? And at what amount of gastric residuals should the nurse hold tube feedings? There are many patients who are malnourished at the time of admission, as well as those who become malnourished during their hospital stay. They are likely to develop nutritional deficits, muscle wasting, and delayed recovery time. These patients are more likely to have longer hospital stays, which in return increases the cost of the hospital stay. They have higher mortality rates, are at increased risk for developing pressure ulcers and infections, and could have difficulty weaning from the ventilator. Some patients in the ICU go without nutrition for days. Is there a way to provide patients with nutrition within 24 to 48 hours after admission to the ICU? Enteral nutrition protocols are used in other hospitals and have been effective. Currently at Providence Medical Center, there are no nutrition protocols that help encourage starting nutrition between 24 to 48 hours after being admitted. According to the American Society for Parenteral and Enteral Nutrition, also known as ASPEN, it recommends initiating enteral nutrition within the first 24 to 48 hours of being admitted to the ICU. Currently, there is not a dietitian in the hospital on the weekends, and if the patients are admitted on a Friday, it could be Monday or later that nutrition is started. Some physicians do not look into depth about nutrition, and unless it is brought to their attention, they may not think about it. My recommendations to help improve the delay in nutrition and meet the standards of initiating enteral nutrition in the first 24 to 48 hours is by developing a nurse-driven nutrition protocol in which the patient will be screened every 12 hours regarding their nutritional status. There are 25 to 55% of patients that are malnourished at the time of admission. 33% of patients become undernourished during their stay in the hospital. Malnutrition can have negative impacts on patients such as decreased wound healing, higher infection rates, increased complications, increased mortality rates, increased pressure ulcers, increased length of hospital stays, and increased costs. What is it that you can do to help? Every shift there will be an assessment to determine if a patient is able to start enteral nutrition. There is an algorithm to help determine if the patient is able to start enteral or other forms of nutrition. Here is the nutrition algorithm that we have developed. It starts with asking about if the patient is hemodynamically stable or not. Obviously, if the patient is not hemodynamically stable, you would continue medical treatment and reevaluate every 12 hours as needed. But if they are hemodynamically stable, then we would go on to the next question and just follow the algorithm. So the next question would state, does the patient have a functioning GI tract? Well, if they have GI bleeding, intestinal obstruction, an ileus, hypomotility of the intestines, severe diarrhea, high output fistulas and pancreatitis, those would determine that they do not have a functioning GI tract at that point, and that needs to be directed towards the GI doctor. But it goes on, if that is a no at that point, then will they be NPO greater than 7 days or less than 7 days, and you will consult a physician to get either a TPN or a PPN order. But if the patient does have a functioning GI tract, then we would go to initiate the enteral feeding protocol. And there are several things under that protocol that would be initiated, like inserting an NG, OG, or Dobhoff tube, verifying the placement of those tubes with a KUB, checking blood sugars every 6 hours, because in our ICU we typically maintain a blood glucose between 140 and 180, and then if they reach above those, then we would obviously get insulin orders from the physician. Keep the head of bed elevated between 35 to 45 degrees at all times. Aspirate the gastric residual values every 4 hours with NGs and OG tubes. Begin with water flushes of 30 mils every 6 hours unless otherwise ordered. And then start specific tube feeding formulas at 20 mils an hour, increased by 10 mils an hour every 8 hours, until at goal rate. Then it goes on to talk about if the patient has any kind of kidney issues. If so, then they would start on NovaSource Renal. Then if they have diabetic issues, they would be on Diabetosource. Now say they have both, they would do the NovaSource Renal. And then if they don't have either of those issues, then they would go on to all other patients would have FiberSource. And at the bottom of the algorithm, it talks about the gastric residual values, and at what point do we hold tube feedings is when the gastric residual values is greater than 500, and at that point, that is when you would return 200 mils of the residual and disregard the rest. Then you would hold the tube feedings and recheck the residuals in 2 hours and repeat if you need to. If they continue to remain high, then you would contact the dietitian or physician at that point. Here are the references for this presentation, and I hope you enjoyed it. Thank you.